What is chronic plantar heel pain? Chronic plantar heel pain is just inflammation and pain on the plantar fascia, okay? So you're having pain, you're suffering from pain on the bottom of your foot, all right? That could be related to soft tissue, muscle, tendon, and ligaments. It could be related to bones, and it could be also related to people who are suffering from systemic conditions like rheumatoid arthritis, diabetes, hypothyroidism, perhaps gout. All these conditions, there is a relation with that and chronic plantar heel pain, okay? All right, why are people suffering from that, from chronic plantar heel pain? So pretty much could be a different situation. Let's gonna start with one. It's gonna give you 3 or 4 different examples. One is a very common where people actually confuse that symptomatology with chronic plantar heel pain, and it's tarsal tunnel syndrome, which is your tibial nerve, which is part of the sciatic nerve, coming out of the back, go down the leg, go back the posterior leg, and then go to this channel here, or tunnel. Okay, a tunnel or canal, whatever you want to call it, and then it's actually refer pain down the plantar. So what you can do yourself, actually, you're gonna tap here in this area. Okay, this is the medial side of foot, and then you see the malleoli. Okay, so you go a little bit lower down and you're gonna tap on that. There's a refer pain or tingling or numbness or anything like that down the foot, you may have a little bit of irritation of the tibial nerve, and that's called tarsal tunnel syndrome. I always confuse with carpal tunnel. All right. Second thing, you can have a bursitis. Okay, back here in the calcaneus, the bursa could be inflamed, and then you're suffering for that. You may even have a tendonitis, or you may even have some issue with the muscle here. And then they tender, you get a trigger point. We do palpations, and they find the trigger point, and sometimes people are really, really tender. Could be also on the gastros, the soleus, which is the muscle under the gastros. Could be on the peroneal muscles on the lateral side of the leg also, and also in the anterior leg, okay? The tibialis anterior, it may be also a trigger point down there, and we find it up here in the top, and then, woof, people feel pain like that. Runners suffering a lot from that situation, okay? Okay, other thing could be fractures. You have a fracture like before, like me, I suffer from fracture of the tibial and the fibula, the bones fracture, in my case when I was a child, a teenager, and then that create a short, anatomical short leg in my case, and definitely a deviation on my pelvis. And for that, I have some issue with my low back and my foot, pain and situations. All right, let me keep going with that. So you have a short leg. The short leg definitely could provoke, because the weight, 20, 25 pounds, 10 pounds more, leaning in this side for a long time, eventually it's gonna make your pain suffer a little bit. All right, so we're gonna keep going. Other situation could be if you have overpronation of the foot, meaning the foot when you walk, do this, okay? The pronation is just too much, and then it's putting a lot of pressure on the transverse arch down here, okay? And the longitudinal arch and the transverse arch, and then it gives you pain. With time, it's gonna put a lot of stress on the fascia right there, okay? And then we have the most common, and then the plantar fasciitis, where people like to talk about that one a lot, and definitely the most common issue that you will have when you have chronic plantar heel pain, all right? So go to the plantar fascia. What is plantar fascia? Plantar fascia, again, is pain and inflammation, but it's also a microtearing. It's a tear on the fascia, okay? The fascia go from the tarsal bones, okay, to the calcaneus right here, all right? So something like this, okay? And then that fascia get inflamed, and then also there is a tear right here in this area, okay? How you can find it, the same. You find the medial side, the medial malleoli, the medial malleolus, or the medial ankle, and then you move down there, and then you touch all the way down here in the bottom, and find this area. If you press, and then you got that pinching, stabbing pain that nobody likes, you are suffering from plantar fasciitis. I've never experienced that before. How do you know you have plantar fasciitis? When you get from bed, okay, you step from bed and you put your body weight on top of your foot, and then you walk, and then you step, and you got that pain. Oh my goodness, you're suffering from plantar fasciitis. It really, really hurts, okay? Then other situation, then you can have pretty much you have pes planos, if your pes are really flat, or you have pes cavus, meaning you have too much arch here. That definitely could give you plantar fasciitis. Okay, all these situations could add to plantar fasciitis. Okay, so let me see. The next question would be, how do we? Okay, what provoke plantar fasciitis? You say then pronation of the foot, pes cavus, or pes planos. They all definitely going to provoke that, because the plantar function, one of the main function is to, of course, absorb the shock. It's a shock absorber. When we run and when we walk or we're jumping, then this fascia, this pattern there, then help us so we don't break the bones. Also the muscles, posterior muscle, anterior muscles, and the lateral muscle of the leg, of course, they help with the shock absorption when we're running or walking. But the fat down here, the pad in the bottom of the foot, is very important. Okay. Some people also develop bone spurts. Okay, here in the calcaneus. It's not really related to that. Bone spurts, I want to make this clear here, doesn't create the plantar fascia. Okay, so it's two different situations. You can have a really bad plantar fascia and cannot have any spurt, and vice versa. You can have like a really huge spur here, and you heal her, but there is no pain on the plantar fascia. Okay, so there is a relation, but it is not. Okay, so the plantar fascia is pretty much more like a tearing here on the fascia. Okay, and inflammation of that situation because overuse. Let's say that you went out for running, or you've been running with the shoes that is not good quality, or you're pronating too much, or you have a short leg, or you're using shoes that are really tight, or boots, and then standing for a long time at work. All this is going to create irritate the fascia and may create plantar fascia, or make it the tearing on the plantar fascia. Okay, so how do we diagnose? How do I diagnose plantar fascia as a chiropractor, Dr. Chiropractic? Number one, I like to palpate. Okay, I like to palpate, and then again we go there, patient go prone or supine, and then we go there, and then we go, whoa, a lot of pain. Then we know it's plantar fascia right there, plantar fasciitis in this area. Okay, second thing, I take x-rays, very important. Okay, so some people have, it's very rare, but some people develop tumors on the calcaneus. Okay, these sarcomas and then or lymphomas. Then we have to be careful with that. It's just, like I said, very rare, but we take the x-ray just to see the bones, and if there is any misalignment of the bone, which is happening a lot, and we adjust the foot also. We know how to adjust the foot. Then, so we do the palpation. I do the palpation, I do the x-rays. So next we go to the orthopedic test, and the orthopedic test is going to include the muscles of the back, low back. There is a relationship in the kinetic chain between the low back, the knee, and the ankle. Okay, everything go together. I cannot think only about the plantar fascia. Okay, then I do neurological tests, and that would be testing to test the sensory nerve to see if there's any damage and compression of the nerve, the tibial nerve, or there's any issues on the low back. Okay, and then it's compressing, damaging the neurovascular bundle. Okay, then also I'm gonna do the neuro test to test the motor nerve, doing muscle testing. I'm gonna muscle test the ankle, all the muscles who cross the ankle, anterior and posterior. I'm gonna test the muscle who cross the pelvis. All right, and that's very important. And lately, then ultimately, I'm gonna do motion palpation. I try to say, okay, palpation, motion, and I'm gonna do a static palpation, both. All right, to find trigger point, etc. All right, so when I have my diagnosis and I'm clear, then it's plantar fasciitis, and it's no tarsal tunnel syndrome, or it's no bursitis, or it's no tendonitis, then I'm gonna go ahead and focus on the treatment for plantar fasciitis. But you have to make sure that you diagnose that correctly. It may be a combination of 2 different or 3 different situations. It could be plantar fasciitis together with bursitis, together with tarsal tunnel syndrome, together with tendonitis. Everything together. All that could be a misalignment of the talus bone. Okay, we'll do adjust. So we have to really know first what is it that we're going to treat, okay? Okay, so the treatment for plantar fasciitis, all right? So we're going to focus, number one, on the spine, okay? I'm a chiropractor, I focus on the spine first. And if you have plantar fasciitis, it's always a relationship with the pelvis, all right? Remember, your sciatic nerve comes from the pelvis. So I'm always going to review if there is any problem, any misalignment, any stabilization, any problem, any stress on the vertebra or the lumbar spine. I also going to check the whole spine, but my focus is going to be on the pelvis and the lumbar. Pelvis, they move, rotate, translate, move anterior, inferior, posterior, inferior, anterior, superior, posterior, inferior. So we have to determine where the pelvis is and try to fix it, okay? Massa imbalance, QL right here, tensor fascia lata, gluteus, abs, you know, we have to see the whole picture, the long and the short muscles, okay? Then I adjust, then after that we see if there's any issue with the knee. A lot of people have issue with the knee. They got knee valgus, or they have history of knee injuries, or they have tendonitis on the knees, and then we see the knee. So remember, you have to see the whole chain, okay? And then when I finish with the spine, then we go right to the foot, all right? So the foot, to see what's happening on right there on the area. And for this, I have a great massage therapy here. We can give the person a great massage. We focus on using some modalities like cold laser, okay, to decrease inflammation. We use ultrasound, also go inside deep. Any ligament issue, any muscle issue, ultrasound is great for that, okay? If the injury is chronic, then we use the infrared, the heat down there, to stimulate the circulation and blood supply to speed the healing. If the inflammation is too bad, then we definitely use the ice. I like ice. It's a little controversial out there. I definitely believe they have some calming for the nerve, and they have some anti-inflammatory property, okay? So ice is great. And also stretching. Stretching, we're going to do a lot of stretching. I'm going to follow up with a video. Then you should find where I'm explaining some exercises, and including in these exercises how to exercise and stretch for carpal tunnel, all right? Then we work on the fascia, of course, and do some fascia release with some instrument that I have down here. Pretty much it, you know, stretching and exercise. Then, covering all that, I sit down and I talk to you or the patient about nutrition. Nutrition is important. Vitamin B complex, important for plantar fasciitis, especially vitamin B6, okay? You should take some vitamin C, okay? You should take some zinc. If you got some turmeric at home, which is great, you go to Whole Foods and grab some turmeric. It's great for, you know, anti-inflammation. You can get some cold water and put some peppermint on it, and then you sit down in your house and watch some TV, and you know that definitely decrease the inflammation and help you to relax all the muscles and feel better with some fresh feed, and then relax the pain, calm the nerve, okay? Then also something you can do in your house, you can stretch, or you can put a bottle of water, cold water, frozen water, on the foot when you're sitting in your sofa watching TV or reading or something like that, and then you can roll you can roll the bottle of water or frozen water on your foot, or you can put a ball on there and do that, and then that's going to stretch a little bit the fascia and stimulate the circulation as well, realign the collagen fiber who's coming, because remember, it was something broken down. There was a rupture of the fascia, okay? All right, so nutrition. It's very important that you start eating better, okay? And you can exercise. Here you have to slow down with the walking and running, but maybe swimming would be a good substitute for this now. And then you can exercise your upper body, your abs, your back, your pecs, your shoulders, everything else, right? And then eating better, okay? So you have to decrease the sugar. Go that, pop that soda and throw it out, and start drinking water, okay? So less salt or better salt, okay, mineral salt. And if you're getting a lot of rice and white flour, like a lot of bread, you have to decrease that too, okay? All that, exercise, nutrition, your body is going to appreciate it so much, okay? And that is going to make your plantar fasciitis, even if you don't believe so, much better. And remember, if you lose some weight, it's also, for the weight, it's also better for plantar fasciitis, okay? So this is Dr. Carrazana, and remember, with the techniques I use, you will never lose. You have a wonderful day. Bye now.